Hi, this is Dr. Daniel Choi here at North Texas Dental Surgery, and I wanted to make a video talking about how we do the all-on-4 or the teeth in a day solution here at North Texas Dental Surgery. So what the all-on-4 solution is that it is a prosthesis that's actually fixated in your jaws and actually delivered to you the same day as your original surgery where we're taking your teeth out or replacing your existing denture. But in order to understand some of the advantages of the all-on-4 solution, I want to take a step back and kind of give you an overview of your other options. So traditionally, we all know people that maybe your grandmother, or relatives, or friends, somebody who has a complete denture. But what a complete denture is that it is a prosthesis made of plastic or acrylic that is just shaped and colored to look like gums in your teeth. So although it may be a great looking solution, patients really are unsatisfied in regards to the ability for it to be retained in your mouth and also the stability when you're chewing or talking. So that's why a lot of patients may stick a lot of denture glue or other solutions on here, but in all practicality, not the greatest solution in regards to replacing your own natural teeth. So when dental implants were introduced about many decades ago, the benefits of having dental implants actually crossed over to implant-supported dentures. Now there's really two classes of implant-supported dentures out there. And the first one is the snap-on denture, and the other option is the all-on-4 solution. And so what really is the main difference between these two? Well, the snap-on denture is exactly that. It is a snap-on denture. And the way that works is that we actually place dental implants within your jaw, and then we have prosthetic parts where they are poking through your gums, and then we have female attachments on the other underside of the denture, which then allows the prosthesis to snap in place. Having them snap in place really resolves a lot of the stability and retention issues that we were talking about that the complete denture lacks. However, in all practicality, patients have just been so much more satisfied with the all-on-4 solution. The reason why patients are so much satisfied with the all-on-4 solution is that instead of it coming in and out of your mouth, it is permanently fixated. And just due to the different design of the system, patients are also very much more satisfied too when they're actually in function, meaning when they're talking or they're eating. So I have seen patients who have a all-on-4 solution on one arch and a overdenture on the other arch. And I've heard from those patients that have picked that solution that patients are just way more satisfied with their all-on-4 solution. Another added benefit also is that realistically speaking, the all-on-4 solution is essentially that. It is teeth in a day. The implant-supported overdenture or the snap-on denture often turns out to be a 4 to 5 month process. So patients usually not only are just more satisfied with, again, the function and the chewing and the speaking, but also in regards to the timeliness of how fast things are done, patients are just way more satisfied with the all-on-4 process. So what I'll be doing in this video is really talking about how we do the all-on-4 process here at North Texas Dental Surgery. So please watch this video and stay tuned. Thanks. All right, so again, this is Dr. Daniel Choi here. So let's talk about the all-on-4 or teeth in a day concept. Again, there's so many names out there that people make on their own, but from here on out, I'll just be referring to the all-on-4 concept here. Just to explain what really is an all-on-4, essentially what we're doing is instead of placing a lot of individual implants inside your jaws to be able to chew and function and smile again, basically the all-on-4 concept is a much more efficient, affordable way to replace all your missing teeth with 4 dental implants and then putting this prosthesis on top and then screwing that in place. And so that essentially is what we call an all-on-4. And again, when we look at the all-on-4, what we're doing is we're placing these 4 dental implants in your jaw. These posterior ones, the back implants, are angled away so that we can create as much what we call anterior posterior spread to get those implants basically as spread out as possible without hitting any vital structures such as your nerves or your sinuses, and to be able to really spread out those implants to support this prosthesis so that when you are chewing that nothing's going to break or anything's going to detach. And so again, that's basically what the whole all-on-4 concept is. I like to tell patients and give a lot of analogies a lot of times. Essentially, if you're going over a highway overpass, what you want to make sure is that the pillars of support for that highway overpass are going to be spread wide enough apart. So when we're chewing and biting down, you're putting a lot of forces down on your jaw and therefore the prosthesis. So you want to make sure that, especially for the posterior area, that you are placing the dental implants far enough so that they can get back there and really support the back areas where you're going to be putting a lot of chewing forces on your molars. And so that's really why the all-on-4 system is designed the way it is. So really what it provides the patients, as I said earlier, to be able to replace missing teeth at a much more affordable solution. And not only just that, but being able to do that all in one day, where we're taking all the teeth out, whether it's a dental bridge or missing a few teeth or just not happy about the current aesthetics. And instead of taking out all those teeth and placing dental implants and going through a 4 to 6 month process, we're now 4 to 6 month process of multiple surgeries. We're now going through a process where we're taking all the teeth out, placing the dental implants, and putting the prosthesis on top. And as a result, you see this beautiful smile and the teeth that we're able to place all in one day. Here's a patient that had a history of periodontal disease, had an implant bridge. This implant bridge fell out on him while he was on vacation on a cruise, and that was very embarrassing for him. So he came into our office, was looking for a permanent solution. So we mentioned the all-on-4, and so this is what he looked like in his final prosthesis, and he's been very satisfied with it. So things to keep in mind with an all-on-4. I mentioned this in the intro video, but the other options of the implant-supported overdenture, also called the snap-on denture. The reason why that can be a problem is that if you don't have enough bone, then that solution is not really an option for you. You can go and you can do more bone grafting, but what that's really going to do is that's going to add on more expense and significant amount of time in certain cases. So that's definitely something that you want to avoid. And so, without going into too much detail, the all-on-4 prosthesis needs enough space. So it's actually a better thing if you don't have a ton of bone available. So if you don't have that much bone, it's not a big deal, and the all-on-4 solution is a great solution to be able to take care of those patients that have that the compromised bone. Of course, there are certain cases where patients may need to get some more bone. That would be cases where patients may have had implant failure before, or if patients may have had large infections, or gone without wearing traditional dentures, or had no teeth for a long period of time. So there are always exceptions to the rule, and we would only be able to find that out if you came in for the consultation and we did the 3D scan. Another important point that we'll be talking about the next slide is the acrylic versus zirconia options. And so that's really basically what we're talking about. When we look at, when you smile and you're functioning, you're chewing on those gums and the teeth, what that prosthesis is actually made of is acrylic versus zirconia. It's very important that you understand the distinguishing factors and why you want to go with zirconia versus the final acrylic option. So, and another point here is you only need to have 4 implants. And so some places may advertise 4 to 6 implants, but in the majority of cases, you only need 4. And to back that up, there are plenty of studies that have happened over the last 10 years really talking about many studies comparing patients that had 4 to 6 implants placed. But again, in most cases, you only need to have 4 implants, and those can totally support the prosthesis that you're going to put in place and the ability to function and chew on top of that predictably. So what we were just talking about, so what are we talking about with the prosthesis? So when we're talking about the prosthesis, we're talking about what we see here, this visible, the gums and the teeth. So this is what gets screwed in on top of your dental implants. Of course, the dental implants are buried within your bone that we cannot see. So again, this is what we call the actual prosthesis. Within that animation, this is the dental implants, these are the multi-angle unit abutments on top of it, and this is the prosthesis that we're going to be looking at, whether it's made in acrylic or zirconia. This is what we're interested in. So as we look here at this picture here, here's a patient that their final prosthesis was actually made of acrylic here. So here at North Texas Dental Surgery, we don't even offer that solution. And why is because several reasons. We say here it's more fragile, it's more prone to breakage. So we're not a big fan of that because you may be out on vacation, you may be out at dinner, you may be at a speaking engagement, and you may be doing something and a tooth fractures off. Again, because this is made of plastic, a tooth can actually fracture off or your denture can split. And so that could be putting you in an extremely compromising position or an embarrassing, position. Also, it's more porous, therefore it's more prone to staining. And also not to prone to staining, but also it's more prone to bacteria adhesion. And as you see in this patient, we took this photo of a patient who came in for a consultation. She wanted a second opinion. She had an all-on-4 done at another dental clinic, and she wasn't really happy about the aesthetics, let alone, on top of the fact that she thinks that there was too much gum here. She was thinking that her teeth looked like horse teeth, and she wasn't really happy about her aesthetics. So, on top of that, this prosthesis is only 4 months old and she has all this staining and bacteria adhesion. So, whenever we're dealing with the mouth, we have, bacteria and biofilm building. Biofilm, which is the slimy layer, which has the bacteria in it, which, if that builds up on your prosthesis and gets around your dental implants, that can really cause issues with your implants over the long term. So that's another reason that we're not, we don't offer that solution here. So just to give you a little information, the acrylic prosthesis is always going to be priced cheaper than the zirconia option because it is a much more cheaper material, not as durable, and so it's always definitely going to be more cheaper as a solution. But again, here at North Texas Dental Surgery, we don't even offer it as an option. It again may be cheaper, but it is definitely going to cost you more in the long run. Again, with your dissatisfaction with it potentially breaking, the staining, and also with the bacteria adhesion that can cause the implants issues in the long run. So we only offer the zirconia solution. And the reason that we do is if you look at the benefits, as you can see, it's a stronger and more durable solution than the acrylic. It is therefore less likely to crack or chip and break compared to the acrylic. Definitely more aesthetically pleasing, so therefore it can mimic the look of your natural gums in your teeth. Now, it does cost more upfront, but it is a lifelong solution. But to really help patients out, here at North Texas Dental Surgery, we do not charge you the significant upcharge that a lot of other dental clinics do to get a zirconia prosthesis. So we know it is the best solution for you, so we don't have that extreme upcharge that a lot of other clinics will do. So keep in mind one last important point. So a lot of dental clinics out there will pull a bait and switch on you. What they will do is they will advertise an all-on-4 with cheaper acrylic prices to get patients in the door, and then they want to offer the zirconia to you at an upcharge. So don't be fooled by the ads that you see online. There definitely are a lot of providers out there to try to pull a bait and switch to get you in the door thinking that they're going to provide you with that affordable solution. So that's one angle that they typically see when I assess the competition in regards to what their prices are and what solutions there are. One final point about that is also when I'm talking about this, really look at the credentials of that provider. Are they a specialist? Were they trained in a US-based residency? How much experience do they have doing this? So that's really something else that you want to really be looking at when you're looking at an all-on-4 solution. So what to expect during the all-on-4 process. So what we do here with the consultation at North Texas Dental Surgery, first we offer a complimentary consultation, and also importantly we have a complimentary cone beam CT scan, so commonly referred to as the 3D scan. So what we do on that scan is, let me show you real quick. What we do with that is we'll go over your CBCTs. So what we do, this is a 3D scan, and typically you may not see this at other offices, but this 3D scan is very important that we take a look at so we could see the overall dimension of the bone. So what we're seeing here is a side profile, and what we're really looking for is vital structures such as your nerves, and also the density and the thickness of the bone. So those are very important things that we'll be looking at when assessing your candidacy, whether the all-on-4 solution is good for you or is right for you. Again, we'll be looking for vital structures. And again, if you don't have this CBCT scan and somebody's attempting to do an all-on-4 on you, all I'll say is that it's definitely not the right thing to do. We definitely do need a 3D scan on you. We can't just use a traditional panoramic X-ray. This is, I hate to say it, essentially useless when planning a 3D. When planning a all-on-4 procedure. So going back to our presentation, we'll go do your consultation, give you your complimentary consultation, and go over your complimentary CT scan to essentially plan out the procedure for you and answer any questions that you may have, and also go over your medical health history. So day of the surgery, when you come in, obviously come in something, comfortable, like clothing, making sure that, you don't eat or drink 6 hours before your appointment time. We want to make sure, because you will be sedated for the procedure. We use IV sedation. We don't just give oral sedation, giving you a few pills. That doesn't really offer you the predictability that the IV sedation really offers you. So you'll be sedated for the procedure. You want to make sure that you bring somebody with you so that they can drive you home. And this is essentially prepare for it to be an all-day procedure. You'll be here for a few hours because we'll be, placing your dental implants and doing the conversion of putting your prosthesis or your teeth in place. So the next step would be sedation and extraction. So we'll bring you in. Again, it is IV sedation. You'll be sleeping through the process. At which point we'll numb you up, take out your teeth, and then start placing your implants. As we mentioned earlier, there is some bone augmentation. What that involves is we may have to add some more bone in some areas, and in some areas we're just really going to be smoothing out that bone. The next step is we're going to place your implants. As I mentioned earlier, you really want to make sure that you check into the certification of your surgeon. Were they trained at a US-based residency? There's different programs out there, perio versus oral surgery. Your surgical specialist may have been trained at a residency for 3 to 6 years, so really make sure that you go see a specialist who's highly trained in this procedure and not only be able to do the surgery for you, but these specialists can really take care of any complications that may arise surgically. So you just really want to make sure that you have a specialist who can take care of any complications that may arise. So after we place the dental implants, what we're going to do is we're going to attach the multi-unit abutments. So these are basically the pieces that go in on top of the implants that are going to be protruding through your gums. So that is what you see as being tightened in this process. Again, these are the multi-unit abutments that go in on top of the implants that are going to be protruding through your gums so that the cylinders have something to grab onto. This is the attachments of the cylinders through which your prosthesis goes on top of. Again, the prosthesis is what looks like your gums and teeth going in on top. This is all done the same day as your implant surgery so that you, again, can go home with teeth in your mouth. Again, this process is called the conversion process, upon which the cylinders go on top of the multi-unit abutments, and then the prosthesis goes on top of the cylinders. Finally, what we do is we use the prosthetic screws and we screw this prosthesis in place. So just to let you know, when you go home that day, you're going home in an acrylic prosthesis that we want you to wear for 4 months while you're healing. The reason why we wait 4 months is we really don't want to disturb the bone while the implants are healing. So that process is what we call osseointegration. And what that really involves is the healing of the dental implants to your jawbone at the cellular level, right? So that typically takes about 4 months. During that 4-month period of time, we don't want to disturb this prosthesis. So during that time, you will be wearing an acrylic prosthesis. Okay, so that's what you should be expecting the day of the surgery to be going home with. So after you've healed for about 4 months to 5 months, what we will then do is begin the process of converting you to your final zirconia prosthesis. Again, the final zirconia prosthesis is what we were talking about earlier. It's the prosthesis that is going to be beautiful, not prone to breaking, and that prosthesis we will place in at about the 4 to 5 month mark. So typically for the post-op instructions, obviously you're going to have a little bit of bleeding and some swelling. We want you on a soft food diet for quite a while, just because, again, while those implants are healing, you don't want to really be putting a lot of forces on your prosthesis. Think about, again, if I was to place a post in a wet concrete, you don't want to load that concrete and be shaking it around and moving around. You want to disturb it as little as possible while the concrete is setting. You definitely want to restrict your physical activity for a few days, and then also use saltwater rinses. And so one final thing that we wanted to talk about, obviously a lot of our patients need to have some financing options. So when you come in for your consultation, We will go over your financing options and help you be able to plan and to be able to get this life-changing solution for you. So not only is it beautiful, but it really is life-changing because it can do so much more for your confidence and also your ability to chew. So we look forward to seeing you here at North Texas Dental Surgery. If you have any questions, please give us a call. We will set you up with a complimentary consultation and the complimentary 3D scan. So we look forward to seeing you. Thank you.